Alright, today we are going to continue our upper limb skeleton lecture, and today we are going to focus on the humerus. Okay, again, the objective is to identify the bones of the upper limb and their bone markings, and this time we are going to concentrate on the humerus. The humerus is actually an example of a long bone, okay, and it contains a bone marrow in it. It has three prominent parts, and the three parts are the proximal end, the shaft, and the distal end. Okay, this is a diagram on a humerus. Okay, as you can see, this humerus has three parts. The proximal part above, okay, yang paling atas ini. The middle part is the shaft, and the distalmost part is the distal end part. Okay, the proximal part has three prominent features, and they are the head of the humerus, greater tuberosity, lesser tuberosity. Right? Again, I repeat, the head of the humerus, greater tuberosity, and lesser tuberosity. The head of humerus face medially, face towards the trunk. Okay, the greater tuberosity is the lateralmost tuberosity in between the two tuberosities. Okay, the lesser tuberosity is the medial part. Okay, it's more medial towards greater tuberosity. In between these two tuberosities, there is a groove which is called the intertubercular groove. Intertubercular groove. This intertubercular groove is significant and important because it is the area where the tendon of long head of biceps brachii runs through the humerus. Okay, the tendon of long head of biceps brachii that runs through the humerus. Okay, and then go down or go distally, you will see that there is a shaft. Okay, shaft of humerus. In the shaft of humerus, you will see that there is one spot of rough surface. Okay, almost at the one half superior of the shaft of humerus. This shaft of humerus, this rough surface on the shaft of humerus is what we call as deltoid tuberosity. Okay, deltoid tuberosity. It is important because it is the area where the deltoid muscle inserts itself on the shaft of humerus. Okay, the shaft of humerus, if you look at the anterior view, it has two surfaces, the anterior lateral surface on the lateral side and the anterior medial surface on the medial side. These two surfaces are important because they are the origin and insertion of a few muscles in the arm. Right, the distal end of the humerus consists of the supracondylar ridges. Okay, there are two supracondylar ridges, lateral supracondylar ridge on the lateral side, which is continuous with the anterolateral surface superiorly, and the medial supracondylar ridge on the medial side, which is continuous with the anteromedial surface superiorly. Distal to these ridges, you will have some protuberance of the humerus distal end, and this protuberance is called the lateral and the medial epicondyles. Lateral and medial epicondyles. Lateral and medial epicondyle, as well as lateral and medial supracondylar ridge, are important bone structures because they are the origins of the common flexor muscles and the common extensor muscles. Okay, I repeat, the lateral and medial epicondyles, as well as the lateral and medial supracondylar ridges, they are important bone markings because they are the origins of common flexor muscles and common extensor muscles, right? And the distalmost part of the humerus, anterior view, you will see another articular surfaces. Okay, another articular surface which is formed by a hyaline cartilage. Okay, this articular cartilage is known as capitulum and also trochlea. Okay, capitulum and trochlea. Capitulum is rounded while trochlea is semi-rounded. These two, capitulum and trochlea, they will form an elbow joint. Okay, they will form the elbow joint with the radius and ulna inferiorly. Okay, the articular cartilage that covers the head of humerus will form the ball and socket joint of the shoulder joint with the glenoid process of the scapula. Okay, now I'm going to tell you a little bit about the clinical significance of the humerus. Humerus has two necks. Okay, has two necks. One is anatomical neck and the other one is surgical neck. Anatomical neck is actually the border between the articular cartilage that covers the head of the humerus and the bone tissue that starts just inferior to it. This demarcates the different type of cells, in meaning the articular cartilage has chondrocytes, okay, the cells of cartilage, while the cells inferior to it is actually osteocytes, which is actually bone cells. Okay, so that is an anatomical neck which demarcates the different structure of the two cells. Just inferior to the two tuberosity, the greater and the lesser tuberosities, there is the demarcation of surgical neck. Okay, demarcation of surgical neck. The surgical neck demarcation is an important clinical significance because this is the weakest point of the humerus. Okay, the weakest point of humerus. Why this is the weakest point? Because if you look at the proximal end of the humerus, it is wider as compared to the shaft of humerus. And the weakest point is actually the point or the junction where the proximal end widest diameter funnel ataupun mengecil dia jadi macam corong tu, mengecil, funneling into the shape of the shaft of humerus. So this is the area where the humerus receive most of the pressure in cases of trauma and fall, right? So therefore, if you see a patient who fall on the side of the shoulder or receive a trauma to the front of the shoulder, usually the surgical neck is fractured. Now we want to look at the posterior view of the humerus. Okay, if you look at the posterior view of the humerus on your right handmost diagram, you will see that you can see the head of humerus, you can see part of the greater tuberosity, but you cannot see the lesser tuberosity and the intertubercular groove, because the greater tuberosity, lesser tuberosity, and intertubercular groove are actually can be seen clearly from the anterior view of the humerus. When you go distally on the posterior side, you will see that the area is smooth and there is only one small groove which is known as the radial groove. Radial groove is actually an impression that is caused by the radial nerve. Radial nerve runs through the shaft of the humerus posteriorly, and it causes this impression, which is called the radial groove, okay, at the lateral part posterior side of the humerus shaft. And then when you go distally on the posterior side, you will see that the posterior part of the humerus shaft has a very prominent lateral border and medial border. The lateral border will then continue distally as lateral supracondylar ridge and lateral epicondyle, and the medial border will continue distally as medial supracondylar ridge and medial epicondyle. Okay, so remember, both lateral and medial supracondylar ridges as well as lateral and medial epicondyles are important bone markings for the origin of common flexor muscles and common extensor muscles. Okay, one significant bone markings at the posterior view of the humerus is at the distal end of the humerus, where you can see quite a big cavitation at the distal end. This cavitation is known as the olecranon fossa. Olecranon fossa. This cavitation is important because this is where the olecranon process of the ulna will form the elbow joint with the humerus. Olecranon process of the ulna will form elbow joint with the humerus. Okay. Therefore, in order for us to determine the sidedness of the humerus is there are two ways of looking at it. Number one, look at the head of humerus. The head of humerus will always faces medially. The head of the humerus will face the trunk. Okay. Number two, the olecranon fossa is always posterior. The olecranon fossa is always posterior, and you can always see greater tuberosity, lesser tuberosity, and intertubercular groove on the anterior side, on the anterior view. If you were given a picture of humerus, look for these bone markings. Number one, the head of the humerus, which faces medially towards the trunk. And how do you want to know it's anterior or posterior? Look at the greater tuberosity, intertubercular groove, and lesser tuberosity. That means if you can see them, you are actually seeing it at the anterior view. And if you can see only the olecranon fossa, that means you are looking at the humerus from the posterior view. In this case, the diagram that I used in this presentation, the humerus is the right humerus. The right humerus. Okay.